Got a good question here. What to do about my sugar after the MGB? Okay, and you might be on some tablets or some insulin or insulin plus tablets. So what should we do? Well, first of all, we want to talk about airplane crashes. Where does he come up with this stuff? Anyways, imagine that we're landing a jet airplane. That's our goal. Okay, and when you think about it, I'd like you to imagine that we can land the jet airplane by coming in too high. You're okay with that? Just come around and try it again? Or it could land it perfectly. That's okay. Can't stand to come in too low. Got it? Okay, so let's think of your blood sugar. What if your blood sugar is 300 for the rest of the week? I don't care. 300 is bad and will be devastating and lead to complications if you have it that way for years. But this week, I don't care. What if your blood sugar is perfect at 110 all the rest of this week? Well, that's good, but I don't care about this week. What if it's 40?
Ugh.
You fall down the stairs, you hit your head, you have to be admitted to the hospital, they have to decompress the blood clot in your brain. It's a bad thing. Okay, so our plan is we're going to recognize that we're bringing this jet in for a landing. Not only that, but the pilot, me, has landed a lot of these jets. Okay? And we fear one thing, coming in too low. So we're not going to try and control your sugars like you used to try and control them pre-op for this week. Just the opposite. If they're high, I don't care. If they're sky high, we'll take a little insulin, we'll take a little of your medicines, we'll putz around. But what we can't stand is if you get all excited and say, boy, we've got to bring that sugar down. Because that's like the co-pilot or the stewardess or somebody from back in coach coming up and saying, I better put the flaps down. I don't need that. So what we want you to do is tomorrow we'll be measuring your sugars and they're going to be high. It's okay. Then we're going to discharge you to the hotel and we'll have you measure your sugars. And if they're sky high, we might take a little of the Lantus, we might take half tomorrow night, maybe half the night after, things like that. And we're going to gradually bring it down. But we're going to err on the side of leaving your sugars high. Why? Because sugars high hurt you over 10 years. Sugars low can hurt you today. Can't stand coming in too low.
So for non-diabetic to translate that, that means so he takes nothing and then basically see what happens to the sugar and then take
We'll talk every day.
Okay.
Yeah. I'm going to pilot it in. I will be in touch with you every day.
Okay.
And you'll measure the sugars and report back. You guys are the navigator and I'll tell you what to do.
Okay.
And we do it all the time. The worst problem is when people get excited about the high sugar and they try and help themselves. Okay, so like you saw the TV show with Gil Gerard. He started taking some of his glucose medicines and was out here passed out in the car in the parking lot. Okay, now had he been driving or had he been going downstairs or something like that, it could have been a tragedy. Okay, it's no problem to have your sugar high. It's a problem to have your sugar high for years, but for a couple of days, that's just eating a moon pie and a Coca-Cola. We can get over that.